We're back in.
We're back.
All right, everyone. Welcome back. We had a little technical difficulty, but we resolved it. We were talking about PrEP access, and we were just giving some background information about what PrEP is and how it impacts our community. So, David, could you just do a quick recap of what you were saying?
The thing about PrEP is that it's a relatively new biomedical, like pill-driven intervention for HIV prevention. It doesn't prevent against other things, other sexually transmitted infections like gonorrhea, chlamydia, all those kind of things. It doesn't prevent. It's been studied to prevent HIV. The reason why we're talking about it here at Revolutionary Health is because the focus has been on Black gay men, since there's such a high incidence and new case rate of HIV in Black gay communities. The question is, why aren't we taking PrEP more? Why aren't more Black gay men on PrEP? Do we know about it? Are we purposefully ignoring it? Do we not trust the medical profession? Is it something that's based in us as individuals, or is it something more that's about, larger social and contextual and institutional forces? We don't know. Most of the literature tends to put it back on us, saying that something's wrong with us, why we're not taking it, which may be part of the equation, but doesn't fully kind of explain everything. So I wanted to kick it over to Damian to get his sense on it.
You have had experience being on PrEP.
Yeah. So for me, one issue is I think sometimes there are early adapters and late adapters. And I don't know if our community is just a part of late adapters, and whether or not we start to problematize a community about why they haven't made a decision to get on PrEP. Maybe it's just a part of the cycle of adapting new technology, right? Biomedical technology at that. But I missed Johnny's conversation last week, but my experience, knowing all about PrEP since 2012, it still took me 3 years to talk about it with my doctor, and then finally go in and have the assessment and get prescribed and start taking it. And a lot of that was due to, there's a difference between seeing statistics and numbers on paper and in research, and then applying that to a real world scenario in my life and what that's going to feel like, what it's going to look like, and what I'm going to communicate and disclose to people. It was more heavy than how it was presented. But having said that, I'm a huge proponent of PrEP now. Like, I feel like if I had a PrEP evangelist back in 2013 or 14 telling me about their practical real world experience with taking the medication, it would have felt different than pharmaceutical medicine and just being medicalized. Since then, like I think I said this in some of the prior counter-narrative meetings, but I'm the healthiest I've ever been, and it's all because of PrEP. I have hypertension. I was not going to my doctor. I was not adherent to my hypertension meds, and that's been since my mid-20s. Right. Having to go see my doctor every 3 months and have basically a mini physical every time to be more healthy. I'm adherent to all my meds, not just PrEP. And then the psychosocial benefits. Like, I was one who had severe anxiety every time it was time for my annual 6 months, 3 months, whenever I felt like taking the HIV test. And sometimes it was when I knew I hadn't really been at risk, but then you kind of start thinking like, well, what about that one time? So I would have severe anxiety, delay getting tested, all of that benefit I didn't anticipate. And now, like I said, I'm as healthy as ever, getting tested every 3 months, and my doctor every 3 months. And I think if people looked at it differently, if people changed the framing,
you can say counter the narrative, Damian. It's okay.
Counter the narrative. I didn't want to be too punny. All right. But if we counter the narrative around this tool, it's a tool. Right. It's a tool.
Okay,
right.
So I guess, again, trying to address barriers. Okay, so it seems like the conversations I've heard around how to address Black gay men getting on PrEP go something like, oh, we need to do a cultural competence training for the doctors so they know about Tuskegee, or, oh, we need billboards to say PrEP is okay. And I just feel like, yeah, that's part of it. But how do we really move the culture? How do we really move politically? What kinds of policy interventions do we really need that are going to ultimately move the needle? And also, folks, please, make comments if you have questions for the panel, or if you also want to weigh in about like what does it really take, because I really believe it's more than just, I mean, I think that we should train service providers. I think they absolutely should be trained on PrEP, but I also think that training to me just feels feels like a Band-Aid. I think there's some larger structural issues at play, and I think that ultimately to really move the culture, to shift power, I think that we're going to have to think more deeply about this.
I think it begins with asking all of our systems of care. So if that's public systems of care, so like your health departments and your community-based organizations or aid service providers, to even private practices, number one, are you asking Black gay men, are they interested in PrEP? I think we really had to know the denominator first before we could truly say how much more we had to increase efforts versus decreasing efforts.
You know what's funny? I've had everyone offer me condoms, everyone offer me HIV tests. And my whole thing is like, no one ever talks to me about PrEP. Well, except for the white gays. White gays love to tell me about PrEP. But I don't have other Black gay men talk to me about PrEP. I see some comments that I want to address. Mark King says, that's fantastic. That's a fantastic and not uncommon PrEP outcome. I'm as healthy as I've ever been. So that's in response to Damian. Thank you, Mark. Lisa Allen asks, can you speak to clinic level or health system level barriers? Is the PrEP discussion integrated into a well visit or preventative health or testing counseling visit for the target population? Yeah, do you want to take that?
Yeah, I can take that. Thanks, Lisa, for the question. I would probably say no in a lot of respects. And I think the biggest problem with PrEP is that the medication that it's called Truvada, and it's 2 medications in 1 pill. And we've been using it to treat HIV since 2004. So it's actually been effective as a combination treatment with other medications to treat HIV. So typically it's usually prescribed by infectious disease physicians who treat HIV. It's not prescribed by primary care providers. And so one of the barriers that I see is that, especially in the South, where not everyone is in a metropolitan city like Birmingham or Atlanta or Charlotte or, Jacksonville, someplace like that. So people who are in rural areas are going to primary care providers. And I think part of it is a little bit of getting the carriage before the horse. Like, we're still having conversations in the medical community about how to get doctors, nurse practitioners, PAs to talk about sex. And so the problem is that you can't talk about PrEP if you don't talk about sex. And so there are a lot of providers, and this is forget about the gay, transgender, gender nonconforming, forget about all the complexity of that. They can't even talk about it with their straight patients. Like, hey, so you're married with kids. Are you still sexually active with your wife or husband? Like, there are medical personnel that can't have those conversations and have trouble having those conversations. And so what's happening is that those are some of the barriers that are happening. There's obviously a barrier with cost. People don't know how they're going to afford it. People who don't have insurance, people who do have insurance, but the insurance company is kind of stuck on stupid and can't do it, and they don't know where to go or where to turn. There's a lot of judgmental stuff going on in the community, in our community itself, as well as within clinical spaces. Like, somebody will look at somebody saying, oh, I'm on PrEP. And they'll say, oh, well, you just want to have sex without condoms and you just want to whore out over there and just prevent HIV. And that's a stigma that is still real. 5 or 6 years. So,
but as Black gay men, are we already considered hypersexualized anyway?
Pretty much, but
I do want to amplify.
We have a behavioral expert here. We have a behavioral expert here at the table.
Jim Pickett says, I want to amplify Jim Pickett really quick. Hey, Jim. Jim Pickett says, sex is yummy. Stop scaring people about sex. Totally agree. And stop using risk in quotation marks.
Absolutely.
Frame PrEP around holistic health and pleasure.
Absolutely.
Stop with the focus on HIV only. Thanks, Jim. Okay, Damian, did you want to chime in about the hypersexual Black gay men?
Okay, I will table that part. But I also want to just throw in the anecdotal experience that I had, because the doctor I was seeing, she's a straight white woman, bless her heart. And she did not know what PrEP was when I introduced it to her. But she did say, I will refer you to an infectious disease doc. Right. I don't know about that, but they will talk to them. And that's exactly what she did. And once I got matched with the ID doc, it was pretty smooth sailing. Right. There were some issues with insurance and payment, whether I got 90-day supply was cheaper versus that. And it's just all of that kind of stuff. I just had to figure out through experience. Now, as it relates to the perception of Black gay men and hyper risk, hypersexual. I mean, I don't have the data on white men or others what they think about Black men. That's not necessarily what my work is, but we also already know that the data say sometimes we're less risky than the populations we were always compared to.
Right.
So we already have the data that shows that that's not the case. So we don't need to necessarily hear it from anyone, in my opinion, because we know already about our own sexual behaviors and how they are actually protective in a sense. There are other issues that contribute, high prevalence, and I don't know if we're going to get into.
Oh yeah,
the intersexual
you about
nature,
to bring us there.
blah.
Let's go.
But it's not the sex that we have.
Right.
We know that.
Right. It's not that we're having more condomless sex or more partners or more anything than white or Latino men.
If we could just walk out for a second, I'm wondering, so how do we, so where the rubber meets the road is, how do we streamline the process to get on PrEP? Like I recognize that there are avenues for people that, might have, they might not be able to afford PrEP. But it still seems that through the level of administrative burden that is required to navigate those systems to be able to access PrEP become a significant barrier. So my question becomes, how do we sort of streamline the process to make PrEP more accessible for Black gay men, and at the same time, still ensure that there are mechanisms in place to make sure that we're protected, that, our well-being is being considered as we, access PrEP and so forth?
I think it really starts with understanding that you should not take a no. I think we have to instill with everyone who's listening to us and the people who this video will be shared to, don't stop at a no. I think we really have to push back on no on everything, whether or not it's PrEP, whether or not it's treatment, whether or not it's voting on next month. Do not take a no. I think that's where it starts.
So we'll face some barriers kind of in the institutions, but to not say no. I think Damian's story is a great story because he gets referred to an infectious disease physician, and then everything starts. That doesn't always happen, though. Yeah. It's not always that smooth. And a lot of infectious disease doctors don't want to do PrEP because they're busy treating. And then also there's the stigma that if someone who's HIV negative is going to an infectious disease physician, how is that going to look? And what is someone going to say? Oh, I see this doctor, and they'll say, I'm on PrEP. And you see this, and we talked about this before in one of our sessions with Grindr or Jack. People will say somebody who says they're HIV negative and on PrEP is actually HIV positive. And so there's actually like this urban myth going around that people will do that. And whether it's based in some reality or not, whether some people do that, I can't say for sure or not. But there's still a lot of stigma kind of swirling around, both on the provider end. If they don't know, if they don't want to treat it, if they're an ID doc and just want to focus on treatment of people living with HIV, or if it's from the patient's perspective and we're looking at it like, well, I don't want to go into this place and people wonder who I am, especially in rural areas. If you have a cousin or someone else who knows your family who's working in the clinic and may have access to your records, or you're fearful that they'll have access to your records, there are a lot of different barriers that can come up with this. So I think with the solutions, Daniel's on the money with a lot of the work he does. There are a lot of ways we can do things with social media and get PrEP out there. I've seen a lot of these things happen. So I don't actually necessarily believe in this myth that Black gay men just across the board aren't taking PrEP or aren't interested in PrEP because of one or two studies. There are other studies that have come out that have actually documented that Black gay men do take PrEP, are interested in PrEP. I mentioned that their providers never bring it up. And so there was an interesting study that was done that actually interviewed medical students. And they said with the medical students that they compared the reactions to white and Black, I guess it was simulated patients or actors who were playing patients. And they were more likely to believe that their Black patients were going to go out and have condomless sex if they prescribed PrEP for them. And then that influenced whether they would prescribe PrEP for them or not. So you see these biases like play out in these roles. But, to Daniel's point, and also to Damian's story, is like, you have to be empowered. So I think one of the tests that is in front of us is kind of like, well, how can we empower the community to say, if a provider looks at you and says, I don't know anything about PrEP, it's like, okay, well, I brought you some or to this website, or let me explain it to you and we can talk it through. But not everybody feels that empowerment. So how can we mobilize community social media to do that?
I guess I have to disagree a little bit in the sense that I don't want to let healthcare institutions off the hook, right? Like I get that. I get that you have to. I mean, I get that ultimately there is some of that. Like you got to just be resilient, right? Resilient Black gay men,
right?
And just don't take that no. But I mean, I also wonder. Okay, so if from a personal perspective, it's don't accept no, like don't stop at the no, then collectively, then like what is our response, right? So is there a community way? So does that mean we need to sit down with some health commissioner and say, we're going to sit down, we're going to look at the current process for how one navigates the system as relates to PrEP, and how do we streamline this? Like at what level can we hold institutions accountable? At what level do we create systems within existing institutions so that, okay, maybe right now in 2018, we just have to do what we have to do and we just have to be resilient. But maybe this time next year, there are some processes in place where things are more streamlined.
And I mean, yes. And then too, providers need to be creative. I mean, the New Yorks and the San Franciscos have already, like if you test positive and you get a confirmatory, you get a starter pack of your meds, and you walking out the door with 30 days, and then you can figure out your insurance, blah, blah, blah. Let's do that with PrEP. If people are going to get tested and they state they're high risk, let's do some phlebotomy, let's get some blood. And I feel a head shake, but
you said high risk.
Okay. If they report unprotected anal and they test HIV negative, however you want to put it. I understand risk is stigmatizing, and I apologize. It's just ingrained in me to speak that way in public health.
Right.
But yes, there is a way
brotherly
to
love.
Brotherly love. There is a way to make this almost curse. To make this rapid.
Curse. It's
make this shit rapid.
Right.
Don't let nobody walk out the fucking door.
Right.
You have heard their story. They've told you what it is, and they've tested negative by the grace of God.
Right.
Introduce them to PrEP. Have 30-day supply ready.
Right.
Get them hooked up to some healthcare. Do all of these things while they're in front of you.
Right.
I mean, there are creative things that we can do. We don't have to sit back and preach at the population and hope that they get an epiphany and start loving themselves and coming in or whatever.
Yeah. And I truly think entities are asking, or entities are directing us to have conversation on increasing PrEP knowledge. I think the next step is, okay, so now that you increase PrEP knowledge, are you increasing PrEP usage through, insurance access, either during, open enrollment periods? Are you securing, employment that can ultimately lead to private insurance? So truly just wrapping or increasing the wraparound services that are in place already, but it's not at the level that we need it to be.
Yeah, for that. And I think the other opportunity is to have conversations in our friendship groups, to have discussions. And I know some of us are doing it, some are further along than others, but I still wonder, as Black gay men, do we have a hard time talking about HIV within? Did you want to?
I think yes. I know yes. I know yes.
All right.
And it's really, even in a place like Atlanta.
Atlanta.
Like you can find sex in Atlanta easier than finding like a
piece
ham
of
sandwich.
Right.
Whether or not you picking up a prescription at the CVS or you going to Starbucks, you can find someone to fuck with, literally, but we are not comfortable enough to truly say, oh, are you having sex? Who are these people that you're having sex with? And what are the different ways that you're protecting yourself?
Even stuff like, this is sort of forecasting a bit. We're going to have a discussion at some point about like hooking up and how we care for each other around that. But even being able to communicate with our friends, you know what, I'm about to go out. I'm about to go meet this dude. This is his name. This is the address. Like we have to start having these intense conversations. And I wonder if one of the things that we're missing now that there aren't. I know that the behavioral intervention conversation is controversial and complicated. I've always been a fan of behavioral interventions. One of the things I appreciated is having spaces where we could talk about sexuality together. And though those spaces weren't perfect, since a lot of those spaces no longer exist, and I know people like, well, social media has replaced them. I actually disagree. But how do we even get access to the language to be able to describe our feelings, to be able to describe our ambivalence, to be able to describe our fears with each other? Because I think, for part of what happens with that, like sort of perpetual resilience that we have to endure as Black gay men is that we adorn these masks, right? The mask, because in a way to be resilient is sometimes to not be vulnerable for many of us. And so part of wearing that mask is that even with our friends, even with our loved ones, it's sometimes difficult to be authentic, to be able to talk about our deepest fears and things like that. And we don't have spaces where we can get access to them, which so what happens is we're not really having these life-saving conversations.
Yeah, and I think to Jim's point, and also to what everyone is saying, like, we don't really talk. I think I've seen so many conversations about when people say with medical providers, you're supposed to ask about the 6 Ps or 5 Ps.
The what?
5 Ps. It's like partners, prophylaxis. There are 5 different Ps of taking a sexual history that they teach medical providers to do, and one of those Ps is not pleasure. And I think it's always interesting with that, how we don't even couch the language of pleasure and about sex because we've gone off this deep end of like always talking about risk, always talking about if it's unprotected or if it's protected, even if we use the language of condomless, which is more PC right now. There's still like this kind of stigma around it. But I think it's a real conversation to have because no matter what you say, whether you're positive, negative, what's going on, you're always thinking about it. Like there's not a time where HIV really hasn't been a part of the landscape here with our sexuality. So how does that impact us? How does that affect our interactions with each other? How does that affect how we trust each other, how we communicate with each other, all those different things?
Why do you think people call raw sex raw sex?
I like to call it natural.
I call it natural sex. Yeah.
Natural, but see, I think it's different. Like I think raw sex is different than natural sex.
Raw is more animalistic. What do you think? What do you think? Because I think you're asking a question that you already know the answer.
No, I really don't. I don't think there's an answer. I guess when you start talking about risky sex versus the language, I'm like, how did that evolve? Like why that word and not some other? Like why don't people say natural sex versus raw?
Well, I've never felt the freedom to have natural sex. That was never a part of my psyche. Once I came out and knew I was gay, it was just taboo.
And you are like, I don't know about you, we're around the same age. Yeah. Like it's like you are especially for Black gay boys, right? You first learn fear before you learn desire. Yeah. Like, and so they're so wrapped up. It's like you're afraid, you're told like it's dangerous.
Yeah. Yes.
Which is kind of related to the next topic I wanted to discuss, which is around sexual networks and why. So for at least the last few years, there's been a conversation around this thing about Black gay men that both choose to date other Black gay men and may be accused of distancing themselves from the broader LGBTQ community. And I was wondering if y'all could speak about that. Like, what are your thoughts about sort of separatism? And is it and why?
I don't know if I like the framing though. It's coming with a lot of bias.
I'm telling you what the people say.
What the streets say? What they say?
Tell me what the streets say.
Are you calling him on a leading question? Is that what you're calling him? A leading question, right?
You call like gang up on.
I'm just saying.
Whatever. The point I'm getting at is the discussion around sexual networks and how Black gay men are vulnerable through their sexual networks of other Black gay men. I'm just asking that you sort of like provide some insight about like what are your thoughts about that?
Epidemiologically, there is greater prevalence, particularly in cities like Atlanta.
What do these words mean to people?
Epidemiologic prevalence.
Watching Revolutionary Health increases GRE scores and SAT scores.
Right. Drugs. Get your dictionaries.
Right.
Write these words down.
Right.
No, we don't mean that. We're accessible for everybody. We're inclusive.
Right.
To say y'all gonna be elitist.
I'm gonna get so much hate mail. I already, people already think that about me anyway. Charles, you only put the elitists. No.
I mean, so this is the statistics would say that a lot of Black gay men are infected with HIV, particularly in the South and in these major cities.
Right.
So if you follow that logic and you live in these cities and you are having sex solely with other Black gay men, likely it's HIV positive, and depending on the type of sex you have, that person may or may not put you at risk. That's a fact.
Do epidemiologists hate Black gay men?
That's interesting.
That was being flipped. I didn't read it. I'm sorry.
Now,
be quiet.
Maybe?
Now, what? No, we don't believe that.
I'm sorry. Go ahead.
And because the epidemic has been the way it has for so long, what you do with that knowledge, I think, goes into the point that I think Charles is asking. Because you could say, and I actually do have data from Black gay men who know that and therefore say, well, I limit my exposure by not dating Black men.
People say that for
I
real?
would love
People
to read that.
say that.
Oh, you got to name names. Like I put a list.
I've seen that. And then you also have non-Black gay men who know that knowledge and say, I don't date gay men, Black men.
Are you serious? People
Because
are
of that.
They were saying that already. They just used that.
I was going to say,
They were racist
anyway. Yeah,
they were racist anyway, but that was ammunition.
I almost believe that people have preferences from jump and they're just looking for a reason to kind
definitely.
of so they take that epi and they're like, oh my God, yeah, so if there's a high, I'm gonna save myself from getting HIV by not dating other Black men. It's like, well, you kind of liked other men, non-Black men before, right? That was pretty much your MO before this whole HIV conversation, the sexual networks epi came out, and they'd be like, yeah, that's, you know, okay, just claim that and be okay with it and move on.
So, David, do you want to counter that narrative real quick?
I don't know about countering narrative because Damian's stating, he's stating facts with this. I think I read a recent article where people were kind of going away a little bit from the sexual networks. They're saying it's part of it, but then the authors were actually hinting that maybe it's because Black gay men, we aren't being as honest with our providers about our sexual risk. Or not comfortable enough. Yeah. And so that was the thing that it was saying. They were trying to state that, like, almost like we're not telling the truth. But again, the way this narrative always goes is that it's on us. Yeah. So it's not about,
it's your fault.
It's our fault for not telling the truth. It's our fault for not being comfortable. It's our fault for, having trauma inside, for dealing with racism and sexual prejudice. And then when we go in offices spaces, we experience the same old shit. And then we're supposed to kind of, again, resilient John Henryism, rise above everything,
Superman,
and be Superman. And then all of a sudden you're supposed to be the most conversant person in the face of this planet and be honest and upfront and forward about everything. And people can't do that. And I think we have to kind of let ourselves off the hook collectively and say, hey, it's okay if you're not comfortable doing that. It's okay if you're not going to discuss this with so-and-so. And it's a process. I think Damian made a good point about, like, this, as things reach out, like, you have to give us time to kind of get used to it. And especially with technology, especially with the medical profession, given the history and the present of experimentation, of racism, all that stuff, like, you have to give Black people time to say, hey, I don't know if I quite trust this. Let me see if I know some friends who've been on it. Like, or someone would say in the past, is my granny on it? Or does she take it? Does my grandpa, has he been on this blood pressure medication?
Is my pastor on it?
Is my pastor on it? Maybe I trust it. But I mean, the thing is that you have to realize that there's a different cultural context with this. And so until we start, like, organically having things that embrace that cultural context first, not starting with HIV first and then backtracking, and how can we put, like, Wakanda on this, or how can we turn this into Black Panther and do this, that, and the other, so that people actually listen to it? Why don't we start with the cultural context first, like it's coming organically from Black folks?
So they have to open a clinic in Wakanda. Is that what you're saying?
Exactly. Yeah. And so Black Panther comes out, I think, digitally on May 8th. That's just a side note, on Apple. I'm excited about that, May 8th.
I also always think that's only the first half of the sentence. Mm-hmm. And the other sentences that we don't get to is around the determinants of health. Yeah. So how many of these people do not have insurance or never had insurance? Or how many of these people cannot access a clinic You know, let alone a clinic that gives PrEP, but a clinic with Black people and Black doctors and nurses. You know, and I think until we truly not until, but understanding that also goes into the reasons why we see, you know, Black people sticking with Black people. I think traditionally speaking, probably it's just been safer for us. You know, if Charles did it, if Johnny did it, if David did it, you know what? If it's good for y'all, it's gonna be good for me.
Do y'all experience? So when y'all do y'all experience it as a political choice when you in your dating life, or is it when you date other Black men? Does it feel political for you? Or
well, you know, I'm a firm believer of Black.
And I'm not making assumptions about who you date. But of course, you know, love is love, and we find love where we find love. I don't judge. I mean, I've only dated Black men, but at the same time, I mean, I also recognize that love. You know, love is complex, and love is love.
Well, I've certainly not been exclusive Black.
Right.
The person I'm currently dating is not Black.
Okay.
So whether there was a lot of maturity in me getting to that point, if I'm being fully transparent, and there was just the baggage we all carry as people of color, especially when it comes to love. Yeah. So I don't know where I'm going with this, but
it's a safe space.
No, it ain't.
Not with Charles.
That's an unsafe space.
But I mean, when it goes back to the epi HIV and this, you know, interracial and sexual networking, I mean, we negotiate risks on a regular basis. Yeah. That's human. Right. That's what we do. Right. When we get in the car, when everything we do, we negotiate risk. So this isn't any different to me. It just is sexy because of its attachment to sexuality.
Yeah, I don't, it's never been a political act for me, and I'm biracial. And so I've experienced like tons of people saying I'm supposed to date a certain type of man. Like, oh, well, most biracial dudes I know, you know, y'all date white men all the time, or y'all only date brothers, or y'all only date this. Wow. But I just knew I've only been attracted to, I think I've only slept with one white man in my life. And that was just a random hookup. But outside of that, white guys don't feature me because I'm light skinned usually, so they don't really pay attention to me. They like chocolate. A lot of the white guys that like brothers.
That's not the part.
I mean, but let's not depart from the topic. But I mean, I do think that's an important thing to talk about. Is kind of how we network, how we see each other, how we love each other, colorism within our community, who's attracted to
that's
what.
Another plug. You know, we're gonna do a colorism discussion.
Yeah, and so what all that means. But I think it is interesting because there was one study that was done like almost 10 years ago now, but it was in San Francisco. And the authors, I think, had great intent because they were trying to show that they interviewed all these different gay men from different ethnicities. And what they found was that every ethnicity didn't prefer Black men.
Wow.
And Black men were like...
Where'd you say the study was?
I'm not going to say in San Francisco.
And I know the first author.
Right. And so it was basically trying to say, and what they were trying to say was that, well, the racism from the gay community, because the gay community isn't attracted to Black men or doesn't feature Black men, except for its kind of, you know, BBC, like Big Black Cock, or there's some kind of like Mandingo thing. Yeah,
wow.
Wow. I'm not even going to pay attention to that. Let me get to my point. So what I think they were trying to say was that, well, there's all this racism within the gay community and gays won't feature Black men. So therefore Black men have limited opportunities to date other men. So therefore, by default, we have to date each other. And I got what they were trying to say, but it almost looked like Black men loving Black men is not the Revolutionary Act. It's a consolation prize.
Wow.
And it was like a default, like, well, I can't get Whitey. And he's like the epitome of masculinity and the epitome of a relationship. Like, what was that post you said on social media the other day? Someone said, if you want a real relationship, date a white man.
Oh my God.
And so and so there are people that have these thoughts in their minds that, you know, in order to get a real relationship, you have to date a white man. And so if you can't date a white man and that white man isn't featuring you, then therefore it's like, okay, well, I guess Charles, you're Black, so I'm gonna go out with you too because Whitey won't date me. Like, what's going on? And so it's kind of like this consolation prize. And when I read the article, I was like, oh my God, what is this? Like, I get what he was trying to say, but I don't think it didn't come out quite right. And it's the wrong I think, message to give. And why can't Black men just be attracted to other Black men just because we think we're beautiful, just because we feel we can be vulnerable around each other, just because we love each other? Why can't that be the case rather than it be, well, so-and-so doesn't like me, and so I guess I'm gonna have to date you.
I mean,
so.
I swipe right on white men and like Latino men on the Tinder, and baby, never get a match. So I mean, I don't think I'm the ugliest girl. So I think it's something. It has to be something.
It's something to that, yeah.
It's really good.
Wait, what does that mean? Swipe right.
On these social media platforms, you can.
Oh my God, I saw like the people talking to Mark Zuckerberg.
Right. You saw like the senators, right? Don't even know what the internet is.
How does Facebook work?
Right. You just sound like the U.S. senators now.
Right.
So this Facebook.
Swiping right for some of our viewers that may not be familiar with Tinder. Could you break down?
Yeah. Right means yes. Left means no.
Okay.
Up means super. You know.
Really?
So like,
they got an up now?
Oh, baby, now you get
See,
you get one free one every like.
Well, he's
30
dating.
swipes.
You don't need Tinder no more. He's got up, right?
Yeah.
Okay.
Yeah. But in essence, if you swipe right and they swipe right on you, it's a match. And then you can talk to them.
Okay.
So like just for shits and giggles at times. You know, I just swipe right
just to see.
You know, just for shits and giggles. Never.
See, I haven't had that experience, but I think this don't sound
put it out
cocky or not cocky, but it's disgusting.
there.
I think I fit the fetishistic stereotype.
Wow.
For that type of swiping and that type of like superficial whatever. So I haven't had that experience. Like I get approached and the matches occurred.
It's because I'm getting picked on Facebook Live and I don't go.
And you got crumbs on your shirt.
This is why. Okay, I got it. You didn't touch your pink yet.
I know. I don't want to eat it. Talk. We said go.
I mean,
we are never gonna get put on the Disney Channel. Like this show, we're not gonna get picked up by Disney at all. We don't get picked up by the BBC. Apparently.
I just to finish that thought though, because I don't like the way it comes off. But I think that
you're attractive to white men.
That fetish is like tall. I think
tall, dark,
strapping.
Right, and it's like. If
like
that
this.
mold, if they're thinking in that concept,
check out these guns.
Like, I'm holding my breath.
Right. How does it make you feel when you get that kind of attention?
I see it for what it is.
So you're aware that you're being fetishized, but how does
because mainly the first contact is something fetishistic. So it comes up early in the conversation. And you know it.
Does it bother you though?
Look at you. I ain't playing with you.
I'm kind of wondering if the reverse happens, like do we, because we fetishize each other. So do you fetishize them the way they fetishize you, but in a different way, like, you know, kind of the stereotypical.
I like where you're going.
Wow, really?
Why can't he be yellow too?
Because I wasn't trying to psychoanalyze him. I was just asking a question.
Right. I don't know. It's an interesting question because on one hand, like we're conditioned in a sense to some of the perceptions that come across. Like you were saying, the hypersexualized.
So like black men are conditioned to expect it.
Right. So when it shows up, it's like you said, how does it make me feel? It just is almost expected in a sense. It's not a surprise. It's not oh my God, how dare you? It's to the point now where it's kind of like, what it is.
So you feel like you're numb to it? Is that what it is?
Probably. And I'm not saying that it happens that frequently, but when it hasn't been this great offense, I'll say. And I think that is due to being conditioned or just expecting.
Wow.
Yeah.
And I wonder if that translates to other environments, like if we're in a retail situation, do we accept it or do we?
Yeah, because for instance, the guy I'm dating now, we go into the store sometimes, and early in our relationship, he would pick up small items in the store and show and just handle and discuss it or whatever. And I'm like
open the package.
Just free to do whatever the fuck you want to do. And I'm like, I don't do that.
Right.
Like, I'm not
Because your mama told you,
right.
your mama told you don't be.
I'm not picking up this
in your
jewelry.
pocket in these people's store.
I'm not picking up this small jewelry item and continuing to walk around this store because I have been conditioned to look like a thief.
Wow.
I've been conditioned to the perception is that I will be stealing.
Yeah.
And so we had a conversation about that. It was fascinating to me, to both of us actually, with that reality. But I think, it's similar.
So we have to go through all that, plus we have to protect ourselves
from
HIV and then assimilate back into a community.
And understanding about PrEP
and
the potential risk factors.
Gotta go to work.
Catch the bar to be late to work.
Wow.
So we have to do all these things.
But we also get to do this. You know?
It's true.
Also,
that's the resilience. That's
those
the
are the
resilience.
resilient things.
And magic.
Come on, John Henry. Let's go.
No, actually, I'm not resilient at all. I mean, I'm clear about that. I'm anti-resilient.
What do you mean?
I know.
It means that I don't I think resilience is typically means obedience to the state. And I don't see myself as being obedient. Like they want you to be a docile subject, which is what a lot of this is about. And I don't see myself as docile. I see myself as having a lot of agency. Right. So I don't value resilience in that way. That's not to say I don't navigate racism and other kinds of structural violence every day. I do. But I also am very intentional about building community around myself that affirms me and holds me down. And that's really the spirit of which the Counter Narrative Project was founded.
Come on.
So feel free to like this video if it responds. And let's have some closing thoughts. And we made Johnny work real. Thank you, Johnny. Johnny's been holding it down back there. We had a little technical glitch.
Thank you, Johnny.
And he done made it happen for us. But we've been going on for
Do we have any big things on the comments?
Let me shout out some comments.
I want to shout out Mark King if he's still on. I read his article on Antron.
7,000. We're gonna actually collaborate. Also, another plug. Me and Mark King, we're gonna do something at USCA around it. We're still figuring it out. There's like a lot of exciting stuff happening in Counter Narrative. Charles, please, LOL. I don't want that. Charles is somebody. Lisa, thank you. Lisa says I'm preaching. All right, Jackson says, do you have stereotypes of white men? I can't see all the comments. Yeah, I'm sorry if we missed some of the comments. They're trying to some of them are not coming through.
Right.
But a lot of affirming stuff. Huh?
You can read one?
We can do one question if you want to.
Sure. This is one final question before we close out.
So John Jordan asked,
hey, John Jordan.
Hey, what options do you have if your body doesn't react well to PrEP? My kidney function was lowered, so I'm currently on a PrEP holiday and waiting for my testing on my kidney function off of PrEP and the latest HIV test.
As far as other biomedical options, there are none that are FDA approved. That being said, some physicians may experiment and do some things, and I've heard stories of people doing that. They're also doing studies right now with a safer version of Truvada that causes less toxicity on the kidneys and on the bones over the long term than Truvada does. And that being said, Truvada doesn't really cause a whole lot of problems. Like, it's a small number of people that actually have problems with it. So I'm sorry you're having difficulty with it. I think when I see a patient that does it, and I've had a few patients, maybe 2 in the past 5 or 6 years that have had problems with it. I just tell them to try to explore the other things with pleasure. Like, if you're that worried and you're anxious about intercourse, and particularly if you're bottoming and you're worried about that and you don't want to use condoms, find other ways, toys, role play, other kinds of foreplay that you can do to make sex a lot more pleasurable until things calm down with the Truvada. There are also other things that people don't know. Like, there's some medications. If you take a lot of Motrin, ibuprofen, or naproxen, that can irritate your kidneys. If you're on antibiotics like Bactrim, that can irritate your kidneys. If you're taking a lot of protein supplements, if you're working out, if you're trying to become big and buff like Damian, what happens is that, keep trying. But I mean, you can actually you could have issues with your kidneys if you're taking a lot of creatine or amino acids or the powdered drinks that you have. If you're doing that, a lot of times that can box your kidneys. And when you're putting Truvada on top of that, it causes a lot of problems. Also, make sure you're drinking a lot of water, 1 to 2 liters a day. You want to make sure your pee looks like the color of light lemonade. All those things can help you. But as far as other solutions, explore other options, wait it out until you get some other labs back, drink a hell of a lot of water, stop using any medications or supplements that could be damaging your proteins, and then wait, because there may be some studies coming out soon, and hopefully they'll have FDA approval on some alternatives to that. There's also an injectable version of PrEP that is expected to come out sometime soon. So there are a lot of different options with PrEP that are anticipated to come out in the near future, but they're just not FDA approved right now.
Awesome. Thank you, David.
No worries. I had to do my doctorly thing by the end of this. We always gotta have
If someone
I get to be doctor for a second.
Final thought.
One doctor stuff.
Right.
If someone asks about PEP, what is PEP? Or could you speak about PEP?
PEP, post-exposure prophylaxis. So in essence, you had a situation where you believe you came in contact with HIV. PEP is crucial because it's time sensitive. So PEP should be taken within 72 hours. Oftentimes, it's accessing PEP through maybe your emergency room. If your emergency room doesn't have any calls, also think about your urgent care sites, or quickly just like Google PEP information at one of the health entities, and it's a 1-800 number also. I think you can call the 1-800 HIV hotline to get specific resources in your community.
Also brilliant. I'm so grateful to be in presence.
So he's buttering us up at the end of this.
I've been exceptionally nice today.
You have. It's been wonderful. Thank you, Charles.
Yes. Any closing thoughts or final words you want to share before we say goodbye?
Sex is pleasure. Enjoy it.
Don't take no. It was really nice being here. Thank you.
Thank you
for opening up your home. Did you say thank you to me?
Thank you.
We want to come back.
That's up to Charles.
All right, y'all. Thank you so much for joining us. As always, we are live every Tuesday at 7:00. Please join us. Again, if you're watching this on YouTube, please make sure you subscribe to our YouTube channel. Don't forget to join our email list at thecounternarrative.org. So please join our email list. And finally, on Facebook, please follow us. All right, everyone. Thank you so much.
Good night.